launching a national conversation on the National Health Service. What was the point of Lord Darcy's review?
Lord Darcy's review set out the scale of the challenge that we face. He said very clearly that the NHS and care system is broken. We agree with him, but it's certainly not beaten. There's a fantastic opportunity now with this launch of this big national conversation. I'd urge all of your viewers to get involved. The online platform change.nhs.uk. We're going to have 100 events across the country feeding into a plan that's going to be published in the spring of next year. That plan is going to be about 3 big shifts from analogue to digital, from hospital to community, and from sickness to prevention. Those are going to be the big drivers for the transformation of our health and care system into a system that the country can once again be proud of, that is actually delivering in our communities and helping people to live longer. Yes, longer lives, which is great, but also healthier lives. Live healthier for longer.
OK, let's unpack that a bit at a time. You say that you want patients and the public to offer their views. The NHS is underfunded, not under-reformed, says a letter signed by 10,000 bereaved families delivered to Downing Street, I should say. It's more money that's needed, not a talking shop, they say.
I think you have to have investment going hand in hand with reform. Otherwise, it's a bit like turning the taps on without fixing the plumbing first. We recognise that the NHS does require investment and funding. That's absolutely right. But it's not either or, it's both and. If you don't reform, if you don't get the basics right, fix the foundations in terms of sickness to prevention, hospital to community and analogue to digital, you'll have a system where you're pulling the levers, but it's not working properly. And I think most people across the country absolutely would agree with that, would accept that there's a frustration around the system not working as well as it should. It needs to modernise. We're absolutely committed to delivering that. But of course, we recognise that investment is also very important.
I remember having this conversation back in 2002 with Tony Blair, so I went back to have a look at the National Programme for IT, which you introduced back then. Costs ballooned from 6 to 12 billion. It was one of the most expensive public sector projects in British history at the time. It failed. It was dismantled.
I think the big advantage we have right now is that we have the app, we have a commitment to single patient records. The functionality of that app, though, is nowhere near where it should be. So we're going to introduce a data bill. My colleague Peter Kyle, the Secretary of State for Science and Technology, next week, I think it will be, is introducing the bill, which will create the protocols that you need to share data far more effectively, so that GPs can share information with hospitals, patients can share information with GPs, patients have control over their own medical records.
That was supposed to be the case 20-odd years ago.
Well, Kay, look, we've had 14 years of Tory neglect and incompetence.
This was when you guys were in charge.
Yeah, well, we, of course...
And you had 9 years at it, and it didn't work.
Well, when Labour left office in 2010, the patient satisfaction levels were the highest since the creation of the NHS
on this
in 1948.
IT system, it didn't work.
And in the last 14 years, the Tories have squandered the golden legacy that we handed to them. So we're going to give it our best shot right now. We're going to fix it because I think the sense of urgency across the country is greater than it's ever been.
You didn't do it last time.
Well, the sense of the depth of the crisis that we're facing is it's the worst we've seen, and I think people have got that sense that we've got to fix this now. This is our last chance, as the Prime Minister has said. Reform or die.
Okay.
We're passionately committed to an NHS that's free at the point of need, but if you cherish something, you have to be prepared to change it.
OK. Between 2019 and 2023, the hospital workforce rose by 17%. In that time, surgeons performing 12% fewer operations, doctors and nurses seeing 18% fewer patients. Increasing the workforce is clearly not the answer to reducing waiting times. What is? A smartwatch? I mean, how are you going to fix it?
Well, that's where the shifts come in. I think what we've seen is that too much pressure has gone into the acute sector. The way to deal with that is to take pressure off the acute sector. The way to do that is with things like neighbourhood health centres, where you have your GP and your dietitian and your physio and your mental health support and your district nurse all in one place so that people can be treated there in their neighbourhood rather than having to go to hospital. And then it's sickness to prevention. Look at the really interesting project we're piloting in Wolverhampton, where we've given people personalised fitness goals and incentives to eat more fruit and veg. We've seen a massive increase in steps taken, fruit and veg consumed. That's something we're looking at in terms of spreading that across the country to get people working more on their own health and keeping them away from hospital. And then, of course, the technology side is absolutely vital.
We've dealt with that, yeah.
We've looked at that. Yeah.
OK, talk to me about smartwatches. Who's going to get one?
So when you look at people who have type 2 diabetes and high blood pressure, many of those people are having to go into GP appointments or even hospital appointments to get their glucose checked or their blood pressure checked. Give them a smartwatch and they can check that at home.
How do you do that?
Well, the technology, the wearable tech, enables you to check your blood pressure. And
on a smartwatch?
Yeah, the wearable tech that you have, I think.
Are you sure?
The smartwatch and the other wearable tech that's going to be made available will enable you to do both the glucose checks and the blood pressure checks at home, so that, of course, if there are red flags, you need to go in and see your GP or go to the hospital, that's fine.
Okay.
But it's not a good use of our health services time for people to be having those repetitive appointments when they could be using tech to sort it out at home.
How are you planning to increase productivity?
Well, there's a massive challenge around productivity. Tech is a big part of the answer to that. I think also, if you look at GPs, we need to ensure that we have continuity of care. One of the challenges people have is they're going in to see a different GP every time they go into their GP surgery. That's crazy, because the more a GP knows about a particular patient, they are ready then to give them the advice they need, give them the prescription they need, and that means that that patient doesn't need to come back. So there's a big opportunity around primary care and productivity in GP surgeries. We're going to adjust the quality outcomes framework so that GPs are incentivised to have continuity of care. It's basically around bringing back the family doctor.
OK, and the reason I'm asking is because you gave junior doctors a 22% pay rise without any corresponding commitment to higher productivity.
Well, the strikes were costing the country £1.7 billion
but that's a fact,
year.
Isn't it?
And all of these targets we've talked about today, none of those would have been achieved if my colleague Wes Streeting hadn't gone in and sorted out the strikes within a week of us coming into office.
But why not ask for a commitment for greater productivity at the same time?
Well, look, I think everybody's committed to greater productivity. The plan that we're putting forward, the big national conversation we're having today, productivity is going to be at the heart of that. And it's a fantastic example. It's a fantastic opportunity for everybody to get involved. That plan that we publish in the spring of next year is going to be all about driving up productivity, modernising our health and care system, keeping it free at the point of use, but in a modern setting. And the productivity side of that, both in terms of moving people away from the acute sector, so hospital to community, using tech more effectively, so analogue to digital, and getting people's lifestyles improved so that they don't have to go and use the health system in the first place. That's going to improve productivity
So why
massively.
didn't you ask junior doctors for a commitment to higher productivity when you said, there you go, 22% pay rise?
Well, I think it's absolutely built into the system that we've got to improve productivity. Every single junior doctor in the country knows that. They're totally committed to doing that. But those strikes were costing the country £1.7 billion a year. And let's not forget what we've achieved in the last 14 weeks. We've sorted out the strikes. We put 1,000 new GPs onto the front line.
Created a £9 billion black hole in the process.
We've brought legislation in for a fair pay agreement for adult social care workers, 130,000 vacancies in adult social care. We've done more in the last 14 weeks than the Tories did in 14 years.
So what are you going to do about the assisted dying bill? How are you going to vote, and what, if it goes ahead, and what impact could it have on the NHS?
I think it's great that we're having a big debate and conversation about what to do with people.
You voted in favour last time.
I voted in favour of the bill back in 2015. I need to look in detail at the bill that's been published by my colleague Kim Ledbetter, but I think it's really important that as a government minister I stay neutral on this issue, because it's just really important that we have a debate that's not, if you like, clouded by the views of government ministers.
Your boss, Keir Starmer, and Wes Streeting, suggesting that you won't be breaking manifesto promises not to raise taxes on working people, but goes on to suggest that doesn't include people who earn six figures. Explain that to me.
I'm not going to get into speculation about the budget. The Chancellor's going to set it all out.
I'm just asking you to explain that to me.
On the 30th of October.
If you earn more than six figures, are you not a working person?
We made it absolutely clear that we won't be raising taxes on working people. That means VAT, national insurance, and
even if you earn more than
income tax.
£100,000?
We will not be breaking any of those manifesto commitments. The Chancellor will set the budget out on the 30th of October, and so there's not that long to wait.
No, I'm just asking for clarification from your Minister, if you would. If you earn more than six figures, are you no longer a working person?
The Chancellor will set this out on the
But what's your
30th
opinion?
of October. It's absolutely clear in our manifesto.
It's not clear to me, that's why I'm asking you the question.
Yeah, but obviously the definitions have to be seen in the round, and that's what's going to be put on the table.
You're either working or you're not. I mean, if you weren't earning more than six figures and you're paying a lot of tax, then you're still a working person, surely. I was just confused about what he meant.
It just would not be appropriate for me to speculate on what the Chancellor's going to put into the budget.
I'm not asking you about what the Chancellor's put in the budget. I'm asking your opinion. If you earn more than £100,000, are you still a working person?
The Chancellor's going to set all of this out on the 30th of October. Look, our manifesto made it absolutely clear that we will not be raising national insurance, income tax or VAT on working people. And that is the pledge that will be delivered.
What's your definition of a working person? Let me ask you that then.
The Chancellor will make that absolutely clear on the 30th of October.
I look forward to it. Thank you very much indeed for joining us.